I've got an injury in my foot. It's in the like where the heel. It's kind of like in. It's like a tendon that feels like where the heel is like connecting to the bottom of the foot. That's like where it is. What happened was, I think it was a combination of me working on foot that maybe like I absorbed something because I'd never had an issue. I'd been training for like almost 2 years. You know, I've been doing fingers like long sessions for like 5 months, never had an issue. And then maybe a few days after working on, uh, I got like some pain there, and I just kept training. And then it became sort of like, so it got like irritated, and then it got like, I just kept training on it.
Okay.
So I think it went from like irritation to like overuse to like just injury, to the point where I couldn't train in the last like month or so. I was like basically staying off it.
So overall, it's been more than a month.
It's been, well, actually, if we include the like, because it got hurt and then I trained anyways, it got hurt more, and then I stopped training. So we can look up the date of this thing, but I mean, it's been probably like two plus months.
Okay, over 2 months.
Over 2 months for sure.
And what treatments have you had?
So I've had a few Vitalium treatments basically. Albert went through the knee down. We got some activation, but didn't really like have a big impact. I mean, it was 3 minutes, 5 minutes. It wasn't like big. Joel and Damon went through the back, which again got some activation. I would say I got like relief maybe for like 12 hours or 18 hours, but by the 24-hour mark it came back. And then John Tan did topical, what we're about to do, just like directly into the tendon, and that gave me relief for like maybe 2 or 3 days. And then actually after the John Tan thing, because he probably put like 20 minutes of energy just like locally, and we had like really good activation. And so I was motivated to just like really do the post-op after that and like stay off it. So that was probably like 3 weeks ago, 3+ weeks ago. It was just before the 4th, so almost 4 weeks ago. And then until then, I didn't train until just now. So that's kind of the history.
Okay.
Yeah.
So from a scale of 1 to 10, 10 being extreme pain, how would you rate your current pain level?
Current pain, like if I'm just like walking around, not trying to adjust my weight to avoid pain, I would say it's maybe like, let's call it like a 3.5.
All right. I'm going to put it right there and just relax. And then you let me know where you feel it, okay? And if I'm hitting the right spot. So it's right here, right?
It's right there, yeah. I'm starting to get it. Yeah, if you can just stay there, the activation is building.
Okay.
Just gonna try to relax. It's feeling like consistently activated.
How does it feel? What are you
It's been
feeling?
so it's activated the whole time.
And when you say activated, what does that feel
It's
like?
like in like where the tendon is hurt, it feels like, it actually kind of feels like a mild pain. It's like, it's as if I was like putting weight on it, but I'm not putting weight on it. So it's like kind of the same like pain feeling, and then the and then it's like sometimes I get like, it'll cycle between like a pain and then like a itch, kind of like the scab, like healing feeling.
Yeah.
So part of the problem is we heal someone.
It's like
So he heals someone, and now he heals someone's foot. And now
it's kind of an in between. Like it's like a half pain, half itch.
Yeah.
Maybe like half tickle. Where you
Okay.
have, I don't know.
All right,
But I
yeah.
can feel-
A sensation. Sure.
I would actually say like on kind of the bottom half of my foot in general, I can feel like the kind of like energy like bulb,
Uh-huh.
kind of like in general, but then in that tendon specifically, I can feel like the kind of pain itch sensation.
Okay. You wanted to give it a check to see?
I think I'm. I mean, it feels numb. I think I'm just gonna ride it.
Okay. What,
Yeah.
numb. So what score would you give that?
Right now, so I should clarify the 3.5 is like when I'm doing no caution and I have weight on it.
Okay.
So when I was just sitting here after training, I probably felt maybe like a 1.5 or a 2.
Okay.
It was like perceptible but not bad. Right now it feels kind of like a weird in between, maybe about 20% activated and like 80% numb.
Okay.
Yeah.
And if you had to give it a score, what would that be?
It's kind of like throbbing a little bit. I would say it's weird. It's like I would say like just like kind of like general pain is less. Like if it was a 1.5 when we sat down, it's
Yeah.
probably a 0.5 now.
Okay.
And I would say that separately, I'm kind of having this feeling of numbness on like the whole bottom of my foot.
Mhm.
And then separately from that, I'm kind of getting this like throbbing, like
Sure.
post-activation
Yeah,
feeling.
yeah. And I'm sure you're going to continue to heal. So when you were on it, it was 3.5 when you were stepping on it.
Yeah.
I mean, you're eventually going to step on it.
I'm gonna step
Should
on it.
we put the mat
I
up?
guess I can try it. Yeah.
Take-
So it is. I still.
Oh, that actually hurts more when I step on it.
So I think that what happens is like the best thing to do is like periodically like do a touch on, right? Like we could probably get the pain in 1 or 2 sessions for back and neck pain. Usually 1 or 2 sessions we can get it down to kind of like almost to 0. And then like maybe like once.
Yeah, if I put it feels about the same if I put weight on it.
So,
It'll creep back a little bit.
I think, but I think like what I was telling Albert earlier was that I think that like my knee was hurt before, and at first I called Albert. This was like in my first like few months of training. My knee got hurt, and I called Albert and I was like, "Oh, my knee's hurt. I don't think I can train." And then he was basically like, "Well, just like, but not training is also bad.
yeah.
So just like train lightly or like adapt." And then, and it's like the same thing, even outside of this training, it's like, just with any exercise or any fitness, just like totally dropping it is bad.
Right.
So I think like, I think I can't not train anymore.
Right. That's crazy that it started from a residual.
Yeah, it's like, I think there may have been like, I think
Some
it may have-
damage there
it may have been-
prior.
Yeah, I think it was a combination because I was training really hard, training fingers.
Yeah.
Not break. I mean, you've seen me here. Like,
Right.
I would not break the squat for like 90 minutes or 105 minutes. And I was doing that 5-6 days a week for like months.
Yeah.
But it's kind of like interesting because I was doing it for months, no issue.
Right.
And then, so it's kind of hard to tell. Was it just like it took months for it to get worn out, or was it that really it was that thing, or maybe I was
It's a
holding my
it's
weight.
probably a combination of
Probably a
it.
combination, yeah.
Yeah.
Okay, so earlier I reported essentially after I got healed, Janice asked me to stand up on the mat I was training on, and I basically said the pain didn't go down. But once I put on like my shoes that I've been wearing, and then two things were different. One was I put the shoes on. More importantly, maybe 10 minutes passed, and then walking around, I do feel less pain. So maybe if I was saying that like with pressure, it was like maybe 3.5 before. I don't want to like push it, but like just there, I kind of like put pressure on it, so it actually kind of hurt. But before that, maybe like maybe like a 1, like a 0.5. It was like noticeably like down.
Okay.